Well, hey Myo family, and welcome back to this episode of the Myo Minute. I am Carmen Woodland. I'm your host. I'm an orofacial myofunctional therapist with a large online global practice that brings this important therapy to all corners of the world. Specifically, my practice works really in the realm of wellness. Our specialty is really sleep, airway. I work with some of the world's worst tongue ties. And then also we really focus on wellness here. I work on wellness, nervous system support, digestion. I'm also a nutrition therapy practitioner, so it pairs very nicely when I have clients who don't digest well because of their tongue thrusts and their chewing and their eating habits. Many of them live their life in fight or flight, which you may or may not know is not where digestion happens. So I help them work on digestion and wellness on many different fronts. So I am going to be talking here in this episode and a few more about sleep disordered breathing. This is a big topic, so I'm going to break it down into itty bitty pieces so that it's a little more understandable. I will also make sure that in the blog I have a link to reading the whole Ultimate Guide to Sleep Disordered Breathing if you want to get the whole enchilada at once, okay? So in this quick episode, I'm going to be talking about what is sleep disordered breathing. So this really is a catch-all term that is used to describe a number of different chronic conditions in which either partial or complete cessation of breathing occurs at any time throughout the night. So this leads to things like generalized tiredness, fatigue, poor motivation, lack of energy, that really drastically affects the quality of life for a lot of people. So sleep disordered breathing includes a few different things. So open mouth breathing. This is a learned habit, and it is a result of an incorrect oral rest posture. When the tongue is not correctly resting up against the roof of the mouth, or up against the roof of the palate, up the roof of the mouth is closed, the lips are sealed. The airway cannot be supported, okay? So let me say that again. When the tongue is not in correct oral rest posture, which is completely up against the roof of the mouth closed and the lips sealed, then the airway cannot be supported. So mouth breathing, or oral respiration we sometimes call it, can be the cause of chronic congestion, upper respiratory infections, dental and periodontal concerns, forward head posture, and then craniofacial development issues, okay? So it also increases the risk for snoring, upper airway resistance syndrome, and obstructive sleep apnea. Another important thing to consider is the possibility of a tongue tie. When somebody has the tongue that's tied in the floor of the mouth, it's really impossible to get it into the correct position. It's like working out against an elastic workout band, okay? Okay, the next sleep disordered breathing is snoring. So you guys, normal breathing should be quiet and through the nose. It should be effortless, and it should allow your body to get that deep, restorative, reparative sleep that we all need to wake up in the morning refreshed and vibrant and motivated to embrace the day with joy and enthusiasm. Snoring is a potentially serious form of obstructive breathing, and it can be caused by a number of different factors. Your oral anatomy, okay? Alcohol consumption, weight, chronic congestion. Snoring that is loud and annoying, that occurs when the air flows past the relaxed tissues in the throat, and it causes those tissues to vibrate. So I can oftentimes look at pictures in my clients, and I can see that their uvula, the back of their throat, is really swollen and bulbous, and oftentimes it's really red. And it just looks angry, and I can tell that they're snoring because it's like that airflow is just hammering that tissue, and it makes it really, really obvious. Next is upper airway resistance syndrome, UARS. So some people have never heard about this, and this syndrome is very similar to obstructive sleep apnea in that the size of the airway is decreased by relaxation of the oral tissues. And so this results in sleep arousals and daytime drowsiness. It is different from sleep apnea because the apneas and the hypopneas are either very low or they're absent. So an apnea is completely stopping breathing, and then a hypopnea is shallow. So that's really the difference, is that those are not present in this condition. This tends to be more common in women as well. And then the symptoms of UARS tend to be similar to those of obstructive sleep apnea, but less severe. So it would only make sense that often is harder to diagnose, and it's really overlooked a bit at a time. And then of course last is sleep apnea. So this is the most common. You guys, it is the most expensive chronic degenerative disease there is out there right now. It's not just annoying. It's not cute. Seeing our kids in these situations it's terrible. And it's important to understand that it causes the cessation, the stopping of breathing. So this makes most, if not all, people wake up feeling unrefreshed. They're still tired even after a full night's sleep. They want to sleep more. During the day, many sufferers experience a lack of concentration. They've got brain fog, daytime drowsiness, very low energy levels, lack of motivation. I have lots of clients who have all of those symptoms, and they're really struggling with the weight because it's hard to manage weight when you've got these kind of stress responses in your body as well. So sleep apnea, there's obstructive sleep apnea, and that is when the airway becomes repeatedly blocked. And so this is by collapse of the throat muscles or by the tongue taking up space in the throat, and it limits the amount of air that reaches the lungs. So when this happens, the person may wake up gasping, choking, snorting, doing something like that. The brain, being alerted to oxygen deprivation, arouses the body. Okay, so you can see how this would be very exhausting to you if you do this all night long. I have clients who do this 30, 40, 50 times an hour. So they're not getting any sleep. And it can happen just a few times a night. It can happen much more than that in severe cases. Oftentimes this is unconscious, so the people don't always remember it, but they just know that they feel like a bag of dog crap and they just can't figure out why. There is also central sleep apnea, and so this is a less common form. This occurs in the brain when it does not send the proper signals to the muscles that control the breathing, okay? And then of course, as with anything, you've got complex. So that is a form of sleep apnea when somebody has both obstructive and also central sleep apnea. So what do you do with this information? If you can't tell when I talk about this how important this is, let me just tell you how important this is. It's affecting quality of life. It's affecting lifespan and health span. A lot of people do get diagnosed with sleep apnea and they never get told that there's any other answers, and there certainly is. Myofunctional therapy is one of those. In fact, some of my naturopaths and osteopaths who are more, I should say less Western medicine brainwashed, they will send clients to me and say, hey, I see some concerns here. Let's get Joe through therapy and see if we can get things improved. So I don't know about you, but I would never want to spend my life on a CPAP machine. So anything that I can do to prevent that. And also, regardless of if you already have a CPAP machine, there are likely huge strides that you can make to either improve your numbers or to perhaps get off of that. One great example is I have an older lady in her 60s who has been diagnosed with sleep apnea. She has been, working on it for I shouldn't say working on it because they gave her a CPAP and that was it. But her sleep is not better. Nobody really follows up with her. She feels like crap most of the time. She does not have any vibrancy or pizzazz for life anymore. Her fatigue severity score, which is just a benchmark score that I look at to see how exhausted somebody is maxed. And that really starts to affect your mental health, your mood, your motivation, your pain. Many of my clients are chronic pain clients. They have anxiety, depression, all of that stuff. And a lot of it just boils down to we need to get you sleeping better. And so if you're not treating it, this is a biggie. So if you listened to this or read or whatever you did to get this information, and you suspect or you have a partner or a parent, share this information. The very first step we need to do is an exam so that I can have a plan what we need to do. Sometimes I need to send patients to an ENT first because we have to get the plumbing looked at and make sure that we can nasal breathe. If the tonsils are there, they're going to evaluate those. Sometimes we have to get a sleep study, that kind of stuff. So don't just think that sleep apnea is just a pain in your butt, because it could definitely be the straw that breaks the camel's back. So that is it. I will be back next time. I think we're going to be talking more bite-sized pieces about sleep apnea. Bye for now, and I'll see you then.